health tech or life and science technology would be the next big things for this world.
Techsauce Global, sparking innovative thoughts. One of the biggest fields that is getting a lot of attention for innovation in the future is health tech. And today we're going to take a look at what health tech has been like here in Thailand, and very exciting news indeed with an up and coming startup that has gained a lot of attendance in terms of what it's been doing in the country and what it is planning to do in the future. Today we are going to talk with Dechowat Promda, the co-founder and CEO of HealthTag, which has been responsible for a major project after getting a one-year grant in making a decentralized healthcare information infrastructure that is definitely going to not only innovate technology here in Thailand, but perhaps also change the way healthcare is here in the kingdom. สวัสดีค่ะ
สวัสดีครับ
Thank you so much for joining us, Doctor. First off, for the people who are listening who may not know about your company, can you tell us a little bit about yourself and HealthTag?
Okay, so first of all, I have to say thank you, Techsauce, for having me here. I'm Dechowat Promda, founder and CEO of HealthTag. Actually, I'm doctor. Since I've graduated, I have been practicing in hospitals for 5 years. And I was really happy helping patients getting better from their disease. But I was realized no matter how hard I put effort into help patients, I still have 24 hours limit to help patients one by one. So this is start of my journey to dream bigger and do more to help patients. I start to be interested in deep technology like biotech, AI, and blockchain, and find it can be a solution of healthcare and helps people not only Thailand, but across the world. From there, it's become HealthTag today. So HealthTag is a Web3 healthcare infrastructure that connects all stakeholders in healthcare ecosystem together, like hospitals, healthcare providers, patients, and also health tech ecosystem in one single platform. With this infrastructure, they can connect and share healthcare information with high privacy, trust, and transparency by having patient as a centric and enable a seamless interoperability across this ecosystem and bring these happy solutions for all.
That's amazing. You know why it's so amazing, Doctor? Because, this technology is already something that everyone around the world, the United States, Europe is trying to advance and make better. But here in Thailand, if we are able to actually do that, it's going to be a game changer because, we are very good in providing affordable healthcare to everyone here in the kingdom. But everyone knows if you go to a public hospital, the waiting time, you have to wait so long for a whole day. And also, and and it's because the poor nurses, they have to go through all the documentation and you have all these hospitals working differently in different areas. So if we could connect it somehow, it's definitely going to not only help, cut costs, but also help make healthcare better here in the kingdom. But let's take a look at health tech itself and where it has advanced in the world right now. For people who are not so familiar with it or maybe want to know where it's at, can you tell us how the advancement of health tech has been in the world?
Sure. Actually, I truly believe that health tech or life and science technology would be the next big things for this world. But we need to accept that this industry always be a late developer. It's maybe because it's require a lot of work and long-term study to prove in terms of efficacy, safety, and accuracy for the patients. But with COVID-19, it changed a lot. COVID-19 is a great catalyst for health tech industry to accelerate speeds that we haven't seen before. A lot of health tech are being researched, developed, used, and accepted during these short periods of time, like telemedicine, that people, not only patients but also physicians that always deny and question of this technology, have been used automatically. They accept and find it is helpful for this technology during COVID-19 already. Also, drug development that usually take more than 2 or 3 years with more than 1,000 of people for clinical trial. It's proof that we can make it faster and even faster with AI technology and deliver the best for our patients. And there are lots of great medical technology like bioscience, biomedical technology, Internet of Medical Things, and also those solutions for managing healthcare data that will be reshaping healthcare, that I think will soon supporting healthcare provider and patients to live better and have a longer life.
Yeah, that's something that I didn't think about, huh? I was talking about the hospital system, but yes, it is a very good thing that we could do, and especially in terms of innovating new
Mhm.
medicines with AI. Um, and it's exciting to see how it's been progressing, even though we've had COVID-19 and the whole world went through a lockdown. So I'm sure you
Yeah.
probably were very excited when you went to London, right? Because this
Yes,
year
yes, yes.
you went to London Tech Week 2022. Can you share your experience there?
Sure. Actually, I was really excited because HealthTag is one of three Thai health tech companies that got invited from UK Embassy to join this event, London Tech Week 2022. London Tech Week is one of biggest UK's tech flagship event that brought full host of global government and corporate leaders, senior investors, and tech licensing staff together to discuss the power of technology for societies. So it's a great stage for update future trend of health technology, direction of future technology, insight of global leader of health tech innovation in UK like the NHS. And most important thing is to get connected and learn from tech talents from different parts of the world that join this event. Key highlight that really impressed me are the Web3 is a next big wave of our industry. And
Mm.
it will provide a far more personalized browsing experience for all of us while eliminating central point of control with better privacy, data security, and more human-like interaction. Healthcare data is Healthcare data is always a big issue across the world that needs to be focused. They were keynote by Secretary of State for Health and Social Care of UK that talk about topic data save life. That's very interesting. That UK will focus on three things in next few years. One is interoperability to provide healthcare professional all the information they need to support decision based and on relevant information from the good system. Two is federation of data platform to make data sharing more easily across systems and enable healthcare data integration. And three is the data-driven technologies to allow healthcare organization access anonymous information for research easily. And UK already have a solid action to solve healthcare data issue. And I think also time for every country to aware and take action on this as well.
Oh, so at least we have some good examples from the UK that we can
Yeah.
look to. But obviously, there's different types of case studies that you might have found also interesting as
Mm-hmm.
well, right?
Yes.
Can you give us some recent case studies of health tech applications that you find the most
Mm-hmm.
interesting?
Sure. One technology that I found is really interesting is biomedical technology. This is a game changers and great case study that we need to look into. One of the tangible case study is application of biotech is use support vaccine R&D. COVID-19 vaccine adopt this biotech technology by mapping genome of the virus and get a handle on how it operates by this approach, helping researchers to create the test vaccine candidates and at breakneck speed. And with biotechnology has saved billions of lives from the last pandemic, which will surely be a good model for next vaccine development in the future as well. Another case study is personalized medicine or precision medicine. Up until this point, medicine has mostly been diagnosing and treating people based on observation from treating similar cases in other people. But as we know, everybody are different. Biotechnology can show doctors exactly what those differences are and eliminate the guesswork, tailor the treatment specially based to their specific conditions, genetic makeups, and other health characteristics. And it's like holy grail when it comes to healthcare. And also the 3D bioprinting is also interesting. Every day, 17 people die waiting for an organ transplant. And
Yeah.
according to the Health Resources and Services Administration, and with 3D bioprinting would be next hope of all organ failure that wait for donor. This technology is very practical and will really change the game of healthcare. You are taking this small piece of tissue, grow it, and expand the cells outside the body. Then once it's ready, you seed it in scaffold or 3D printer to make it fit for specific patients. And so 3D print organs still a challenge to make it getting the organ to actually function as they should, which is not fully solved yet, but it's already been used in bone graft and skin for burn wound already. Yes.
Wow.
Yes. This probably my top 3 highlight so far about health tech that I personally interested. But
I think, yeah.
Yes, it's all about life and science technology at the end. Yeah.
Wow. I can't believe that. I mean, you just one day we can just print out an organ.
Yes.
But I think that's probably going to be very complicated though. But it is very exciting to see that you already have the ability to print out like skin or
Yes.
like bone graft. That is very useful for a lot of cases. A lot of cases. But then again, of course, with all that advancement that we see in the international market, here in Thailand,
Okay.
I mean, I know that we can't, it's not a healthy thing to compare yourself with another country or whatever, because everyone has a different economy, everyone has different types of culture and infrastructure. But for those people who are not so familiar with the ecosystem here in Thailand, can you tell us how or at what stage is Thailand at in terms of healthcare development?
Okay.
Or health tech, sorry.
Okay. I truly believe that Thailand is full of talented people, both doctors and technicians. But to move health technology forward, it requires collaboration among these two and support from investors, both private sector and government, which we might not see much in this moment. But in the other hand, that I just went to UK, they are truly an incubation hub of health tech. They are really open for no one, no matter where you're from, how small your company is, as long as you have breakthrough idea for future healthcare. They have a tools, investor, and mentors to support and make things happen. And one point that really amazed me is I didn't hear any of metaverse word or topic in this event, while Thailand is really focusing on this very much.
Yeah, that's interesting.
It's really buzzword in Thailand. So I'm also question is it right timing to utilize this or any other important tech that we need to prioritize and practical in a real life setting first? I love the way innovation that I have seen in this event are very practical and have a great balance between digital world and physical worlds. And I think Thailand is a bit far from that Yes.
You think because I think in Thailand we're so excited. We tend to be a community or a
Mm-hmm.
country where we're easily excited, you know.
Yeah.
And marketing in the private sector always kind of has a bigger presence. I mean, it can't be helped, right? Money is key. You know,
Yeah.
cryptocurrency. You know, you have the metaverse. How can we make more money? But at the same time, of
Yes,
course,
that's
we
right.
have a big medical industry here in Thailand.
Mm-hmm.
But it's just all about how do you develop it. But then it's such a big challenge, isn't it, doctor? Because you know we're going through so many things right now.
Mm-hmm.
COVID-19, we have monkeypox, then we have
Yes.
inflation, we have the
Yes.
poor economy. You know, we already have talks of increasing the minimum wage. I mean, what are the main challenges do you see, you know, here in Thailand that, you know, is
Mm-hmm.
kind of like kind of the big hill that we have to like climb over to be able to develop more in health tech?
Mm. As I mentioned, complexity healthcare system that very individualized in each area. So application health tech is not fit for all. I think it's more about feasibility of technology to make it personalized for all, and also the support from the government. And not just talk about the money, but it's more on the policy that different that focus education research and blah blah blah.
Hmm.
Some people just need opportunity to prove their idea and make change for the world, but it's quite hard to find in Thailand.
It's mindset, no. It's
Yeah.
like everyone is so used to something, and it's, I don't want to say that it's like a generational thing.
Mm-hmm.
Like, you know, the generation before us, and because, you know, I mean, if we want to look at it optimistically, there has been progress in a lot of areas, you
Yeah.
know, in Thailand, you know, the use of QR codes, you know,
Uh-huh.
we're jumping into new technology. But perhaps maybe if I understand you correctly, you're saying that perhaps in the medical field, maybe there still needs to be more open mindedness to innovation.
That's right. That's right.
Mm. And also I was just curious about something. I just wanted to ask a little bit, you know, outside what we had planned to talk today. I mean, if you talk about the challenges, um,
Mhm.
between, you know, you do have the challenge of, okay, we need, you said Web3,
Oh
right? We need
yes,
a big
that's right.
infrastructure. We need to update the speed of our internet and the technology. But at the same time, we also have to update a whole generation of people in and educating everyone, even myself,
Mm-hmm.
to innovation and technology and the new
Mm-hmm.
way of doing things, right?
Yes.
So between, you know, the infrastructure and the people, you know, that we
Mhm.
have to retrain and you know to work the system better, which one do you think is the most important right now?
I think it's about the privacy.
Mm.
Yes. Right.
So the people.
Yes, the people.
Mm, yeah. So yeah, definitely. If you talk about people, then we are concerned about privacy, as you mentioned.
Mm-hmm.
How is your company going to address privacy?
Okay. You all may heard data is a new oil, but for me, data are not oil. They are people. As I said, the privacy is really important. Most of third-party companies try to collect the data and make a benefit from that. Why not? Let's speak about privacy. It's really bad that we not even know how they used to take benefit of our data. For example, use your data to create an accurate user profile and serve you targeted advertising, share data with their partners or sell data to third party. This issue we face a lot in social media platform. Even these are only general information, behavior, lifestyle. We still get very serious on this. But for health data, it will be much more serious because it's all about life. Just imagine one day someone really hates you and access your genomic data. They might kill you without a gun.
Hmm.
Yeah. Or what if insurance company can access your genome and learn you are at a high risk of getting a disease? that
Mm-hmm.
will take $1 million to cure. That
Mm.
might not engage you as a customers, right?
Mm-hmm.
To address the privacy, we need to focus about identity. Identity that it's really you who is the data owner. It's really you who give a consent to someone to access your data, and the mechanic of data privacy become more make sense. Key things that can prove help identify person are diversified to three things that call multi-factor. One is what you have, like your key, Visa card, citizen ID, citizen ID card. You have that card, it can imply that you are owner of the data inside it. Two is what you know, like you typing PIN code or password to access your email account, right?
Mm-hmm.
And three is what you are, like biometric genome. You may use face recognition to access to your Apple mobile phone, but with health information to ensure it's double protected in terms of data privacy. For what HealthTag have done is we have used RFID technology with two-factor authentication for to ensure patients can trust in this infrastructure and make identify process and consent process more simplified. And we may also see RFID implant to make much more secure in the future. And aligning with implication of PDPA 2022 that just have been announced. It will truly support patients' awareness on data privacy, and they can manage their authorization simply. Yes.
Mm. So, with that's very interesting because then you do have a solution to do that. And we've talked about innovation that has already been made, as you said, perhaps even 3D printing and whatnot. What else can we expect from health tech in the future?
Oh, yeah. The drug development will move forward with accelerate speed that we couldn't imagine right now. In the near future, we will see more of AI technology utilized in drug development process because it's already proved in one research that AI can more than 1,000 times faster than one of the fastest existing computational molecular docking models. Also, scientists are attempting to build organ on chip. It's a replicate organ function on microchip so that in the future drugs can be tested on them rather than on human, which will cost less than traditional drug testing method and consume less time versus existing method and more sustainable than testing drug on animals. We have done and learned so far about genomic sequence as well and use a lot of genomic data to support lifestyle modification, right? Medication selection, health prevention that personalized regarding the genome sequencing that we have tested. But in the future, we may see genome edition, which collecting the unexpected gene to be a healthier one. And there are some researchers that start working on this already by injected a gene editing serum into a live patient's liver with
Mm.
with the goal of lowering their cholesterol. It's really interesting because this could potentially save million people from cardiovascular disease and heart
Mm.
attack in the future. Yes, that's what we can expect from very, very, very near future. And last but not least, I really expect to see a world of healthcare is real connected. Blockchain payload for healthcare data science management to make it secure, private, transparency, and allow possibility analyzing big chunks of scattered health data from unidentified sources is the key to constructing the future of healthcare to set a health tech trend. Today is a very start of the journey, and I'm really looking forward to make health tech more precise and more decentralized in the future. And this is what health tech are doing also to make it happen.
Wow. And I'm so happy to be able to sit here and talk to you about it because, it's very exciting to see something like this happening in Thailand, that we are still innovating despite whatever challenges we have in terms of economic, downturn and of course the pandemic. But for those people, both here in Thailand and overseas, who are listening to us now, who, may feel excited as well, but they don't know how to start, if they want to get into health tech, do you have any advice for them?
Sure. My advice is it's always not easy from the start, especially for health tech. That's a lot of complexity and individualized among each area and person. One advice for me is no quick win for this industry. If you're looking for billions in a short period of time, it's not what you're looking for.
Mm-hmm.
Yes. Driving with passion that will change a legacy of healthcare and help people better and live longer are the most important things. And I think in this era, it's no more centralized healthcare because it's less sustainable, but it's more on how we collaborate as a health tech leader. Decentralized healthcare synchronizing together in an appropriate infrastructure will make a different story. Which health tech are doing these things and trying to make this happen. So we're looking forward to collaborate with our health tech and build this trust decentralized healthcare ecosystem together. We are looking for everyone who interested in health tech. Yeah.
So if so people who want to maybe, see you, and maybe collaborate with you or, to seek advice from you, how can they get in touch with you and HealthTag?
Okay. So we have website www.healthtag, HealthTag.io. And also my email is dechowat@healthtag.io. Yes. And we also have Facebook fan page HealthTag มาตรฐานใหม่ของการเก็บข้อมูลสุขภาพส่วนบุคคล
Oh, yes. Okay. And for the rest of the year, are you going to be attending any event, perhaps maybe the Techsauce Global Summit?
I hope so. Yes. If Kun Mimi is invited me, I hope to be there.
Okay. Well, but for those who are listening, of course, you can get more information on Dr. Dechowat and his company HealthTag at our website as well. And of course, get more information from us in terms of health tech and how it's progressing here in Thailand and also the rest of the region. Thank you so much, Doctor, for being with us here and updating us with what's been going on here in Thailand and also the rest of the world in terms of health tech. We wish you all the best ค่ะ ขอบคุณมากค่ะ
ขอบคุณครับ
Thank you. And for our listeners, we'll see you next time here on Techsauce Global Podcast. สวัสดีค่ะ Techsauce, sparking innovative thoughts.